This is Kimormor, a bold initiative that brings services to the doorstep of those that the map often forgets. At Ngeu, where Kenya kisses the border of South Sudan and Ethiopia, for 10 days, Kimormor will crisscross 3 border sub-counties.
This approach was thought out by the Department of Health based on for the agenda of our county. And also we decided to bring all other very important services so that when we visit a particular area, for example, now that our team is in Turkana West, all those other services are rendered at one particular area at the same time, right there. That is basically what it means by Kimormor. Kimormor is a Turkana word that really means putting all things together or services together.
It's a holistic approach of service delivery, targeting human health and animal health. We also have social services accompanying this outreach, including birth registration and issuance of ID cards.
Right under the shade of an acacia tree at Kaemanik village, 120 people were diagnosed in a single day. Most had never seen an X-ray machine, let alone imagine it arriving in their village.
We have screened around 120 patients, whereby we have ruled out around 46 patients have been taken for lab test. That is the patient who have the highest score, because we have met the community whereby we were feeling that there might be some unidentified TB cases here.
Mambo ya TB ndio inalipwa pesa mingi, na hizi vifaa ambayo imeletwa ground ni zile ambazo ziko katika maabara, na kwa hivyo leo tumefikiwa katika mashinani chini ya mti kama wakaaji.
More than just the numbers, this Kimormor was a testament to strategy. Through the governor's mobilization message, more than 70% mobile population was reached.
Why we are saying we are likely to solve 70% of our issues as a county is because by appearing in those various points and then meeting people across Turkana County in the main 6 larger sub-counties, our people will get that service, which I think they never got so many years ago.
We use 3 approaches in terms of delivering healthcare services to our population. One is the static healthcare facilities. Second is what we call integrated health and nutrition outreaches. And the third strategy is the Kimormor strategy, which brings together 3 aspects. One, human health, especially targeting the common zoonotic diseases, and also integrating issues about environmental conservation. 2/3 of our population, that is 60%, have access immunization services, that is 60%. 53% of the population or mothers do access skill birth against the national average of 89%. But because of the Kimormor, we have been able to bring this to around 70%. And that's why that is an improvement from the KDHS survey through this mechanism.
When you look at some of the cases we have reached, we have observed children who have never accessed immunization. In this case, we say 0 doses. And therefore, we go out to ensure that any child within Turkana population context actually access immunization services, so that we acquire the herd immunity, which should be above 85% vaccinated for the population. Looking at the statistics nationally, Turkana County, the gap, that is global acute malnutrition, is around 22%. And therefore, we screen our children, our pregnant mothers, and those who are malnourished are given proper intervention to ensure that we also curtail malnutrition within the population that we do serve.
And for the first time, it wasn't just about health.
So we have two different events that we are taking part in this Kimormor. One of it is a health outreach focused on maternal and child health. And second to that is a dialogue on something very innovative that we are calling the Tree of Men. So this is a behavior change communication model we are piloting, where we are integrating dialogues around child protection with a traditional structure called the Tree of Men. But today, in this particular sitting, in the entire dialogue that we've had for over 1 hour, the men have embraced the conversation, and it's been very enriching. One of the messages that we've been trying to pass is on skillful parenting, trying to pass the message around parental engagement, why men should be involved in their children's education, welfare at home,
The ID registration team expected the usual turnout of 100 per day. They got 600. Not just youth, many were above 50. Some had waited more than 3 decades for a chance to be counted as citizens.
We find people who have never even had IDs for quite a long time because of the remoteness of the area. So far, I've met applicants who are aged 72 years, 60 years, even 50 years, who have never had a chance of registering as a Kenyan citizen.
Tumetarget watu 620 na bado ni wengi na bado wangehitaji kuongezewa siku. Kwa hivyo hii ni namba kubwa kama ofisi ya registrar na ofisi yangu ya chief. Kwa kila siku inafaa tuwe tumeregister watu 80. Lakini hiyo namba 620 ni watu wengi na bado wamepanga foleni. Kwa hivyo mimi nashukuru kwa sababu wataendelea kupata kitambulisho kwa siku chache ambazo tumetengewa.
Sisi tungeomba kitu kimoja kwa serikali yetu. Serikali yetu na ingine ya county. Wajaribu watuongezee hizi masiku za kufanya hii kitu. Watuongezee hizi masiku. Hizi siku 2 ni kidogo sana. Tungeomba watuongezee hata kama ni siku 2 tena ama ama hiyo ni siku 3 at least, ndio hao watu wetu wapate hiyo usaidizi vizuri sana.
It is a very important document in the country that will also solve other issues, like for example the anger safety net program. It highly needs an identity card.
To a pastoralist, livestock is life. Over 50,000 animals received treatment or vaccination.
A disease like PPR, the prevalence within the county was around 20%. But as a result of our interventions, integrated interventions like this one, the prevalence has come down from 20% to about 15%. And also if you look at lumpy skin disease, which is a disease common in cattle, this is a disease that our cattle contracted from the sides of South Sudan. And we've been able to bring the prevalence down from about 15% to about 2.5%.
We actually look at the lifestyle of the community, and again the communities are living together with the animals. So most of the time we do get analysis of diseases from animals that are actually also transmitted from humans to animals. That is, for example, brucellosis, trypanosomiasis, and also rabies. So the reason for us to support Kimormor is based on the disease prevalence of animal diseases, as well as ensuring that we reach the unreached population and the migratory population along the border facilities.
Mfugo bado hapa iko mingi, kama sasa leo tumesanya na bado wale wengine bado walirudisha yao, kwa sababu hapo ilikuwa nini, madaktari walikuwa hapa wamedunga mpaka wengine bado wanasimama mpaka saa hii. Na nilikuwa naomba Kimormor ongeze hata siku, ikifika hata siku 3 hivi kama ni kidogo, watasaidia wakaaji hapa.
The people were hard to reach, they were pastoralists. We thought of an idea of how best we can reach the pastoral community. We had set up container clinics along the migratory routes so that when the population in the move passed by those container clinics, they could access the services, both health and human.
As the tent falls and the trucks drive off, Kimormor leaves behind more than just service. It leaves hope for the young girl who walked with the family, for the elder who finally got an ID, and for the camel that will now survive. the journey was worth it.
Looking into future, we are in the process of developing a bill so that we present to the County Assembly to be enacted as an act of the County Assembly. This will ring fence for us resources that we need as One Health, so that we make it a routine in the near future. We also want these services to be on at the sub-county level.
This is an idea that the government has actually embraced, and we want them to have much more better ways of making it even much better. So that is how I'm thinking, like the government is coming robustly to support this. All the decision, the policy makers, the politicians, and everybody else needs to think on how the majority of our population are really taken care of. And this is the way to go. Kimormor is actually the way to go.
This model is workable, and we want to strengthen it, and we want to ensure we rally our resources together so that it can really work and reach out to our people. It is helping us in terms of our data reporting, improvement of our indicators, and we are truly grateful, and we hope this activity is going to be regular in several occasions.
Why Kimormor is that important in the peace building initiatives, both cross-border and also inside Kenya? It's because we will allow those communities to come and participate. All of them, like now in Turkana West, their Troposa are participating in the process, coming to amalgamate with the people of Turkana County. They come together, share common resources on health, the water points closer to places where we are doing Kimormor, and then the vaccination of their livestock and even kids. So that one alone becomes an automatic element in elimination of conflict between our neighbors. So Kimormor, in its context and meaning, it is one key solution into dealing with insecurity. And of course, in many other previous approaches, we have solved.